Assalamualaikum warahmatullahi wabarakatuh. Good morning viewers. You are still with me, Satrio Bayu Pangestu, on News TV. Thursday, 27 May 2021. In 5 minutes, I will accompany you to listen to the latest news on this sunny morning. Namely, diabetes patient ranks during pandemic, Indonesia ranks 7 highest in the world. Diabetes is a chronic progressive or chronic endocrine metabolic disease characterized by chronic hyperglycemia, high blood sugar. Indonesia ranks 7 out of 10 countries with the highest number of diabetes patients. This is based on data from the International Diabetes Federation in 2020. The number of people with type 2 diabetes continues to increase in various countries in the world, including Indonesia. The number of diabetes attacks in Indonesia will reach 18 million in 2020. This means that the prevalence of these cases has increased by 6% compared to 2019. In fact, according to a recent study by the COVID-19 response team in Indonesia, the death rate in diabetes patients infected with COVID-19 has increased 83 times compared to people who do not have diabetes. Based on data from the Indonesian Ministry of Health, October 13, 2020 edition, the COVID-19 Task Force showed that out of 1,488 patients, around 34.5% of patients had diabetes mellitus. Then of the 1,488 patients who died due to COVID-19, was also found that 12.6% of them suffered from diabetes mellitus. Since 2014, diabetes is the third leading cause of death in Indonesia. This is worrying. The prevalence of diabetes mellitus in Indonesia in particular and in the world in general is quite high and is predicted to continue to increase in the coming years, said Prof. Dr. Mardi Santoso as chair of the Jabodetabek Indonesia Diabetes Association, Persadia. This was conveyed by Mardi in a discussion entitled Daiwong Media Day, Improving Diabetes Control in the New Normal Era, Tuesday, 6 April 2021. Mardi explained this one metabolic disease also involves all organs of the body due to a deficiency in insulin production in the body, either relative, absolute, or insulin production level are normal or excessive, but do not function properly without impaired glucose regulation in several organs. Hence, diabetic patients with COVID-19 tend to be heavier and more, said the professor at the Faculty of Medicine, University of De La Salle. Therefore, controlling diabetes is very important for all parties, from elements of society, organization, health service to the government. Diabetes needs to be controlled and considered regularly because it can cause various complications such as complications in important organs of the body such as the eyes, heart, kidneys, and the brain, he said. Because if not controlled, diabetes can lead to chronic diabetic peripheral neuropathy or DPN or peripheral nerve damage, which can occur due to impaired blood circulation. Not only that, the decrease in blood vessel function that occur due to diabetes can increase the risk of amputation in people with leg ulcers. That is the news that I can deliver. Bye. Wassalamualaikum warahmatullahi wabarakatuh.